Hello, my friends. I am Dr. Awa Mitchell, neurologist and brain health specialist. What if I told you that a medication sitting in your medicine cabinet right now, something you have been taking for years believing it was completely safe, is systematically erasing your memories, shrinking your brain tissue, and increasing your dementia risk by over 50%? What if I told you that over 50 million Americans are unknowingly damaging their brains every single day with medications their doctors assured them were harmless? This is not a theory. This is documented scientific reality that the pharmaceutical industry has deliberately concealed for decades. The research is overwhelming, the evidence is undeniable, and the consequences are serious. Yet 91% of physicians never have this conversation with their patients. They prescribe these medications routinely, never warning about the permanent cognitive effects that accumulate silently over months and years. If you take medications for allergies, sleep, bladder control, depression, or even occasional nausea, what I am about to reveal in the next 15 minutes could literally save your cognitive function and prevent irreversible dementia. Because today, we are exposing one of the most dangerous medication classes ever prescribed, and I am going to show you exactly how to protect yourself with safer alternatives that actually work better. Stay with me until the end because I will provide you with the complete action plan that you can take to your doctor tomorrow. This information is too important to miss even 1 minute. Let me begin by sharing a conversation that happens in my office almost every single week, and perhaps you will recognize yourself in this patient's experience. A concerned individual sits across from me, often visibly anxious, sometimes close to tears, and says something like this. Dr. Parker, I have been taking Benadryl every night for the past 5 years to help me sleep. I also take medication for seasonal allergies and recently started something for overactive bladder. Over the last 2 years, my memory has deteriorated significantly. I forget names of people I have known for decades. I walk into rooms and cannot remember why I went there. I lose my train of thought mid-conversation, and there is this constant mental fog that never seems to lift. I am terrified I am developing Alzheimer's disease. My regular doctor says it is just normal aging and nothing to worry about, but I am only 62 years old. This does not feel normal. Could my medications be causing this? When I hear stories like this, my heart breaks because I know exactly what is happening. This is not normal aging. This is not early Alzheimer's disease. This is predictable, documented, preventable medication-induced cognitive decline. And the tragedy is that it happens to millions of people who were never warned, never informed, and never given safer alternatives. Before I continue, let me be absolutely clear about something important. Everything I am sharing with you today is based on peer-reviewed research published in leading medical journals. This is not my personal opinion or speculation. This is established science. However, this video is for educational purposes only and does not replace medical advice from your personal physician. Never stop any prescribed medication without consulting your doctor first, as some require gradual tapering. Always work with a qualified healthcare provider to make medication changes safely. Throughout my 18 years of neurology practice, I have evaluated thousands of patients experiencing cognitive decline. I have reviewed countless brain scans, analyzed extensive cognitive testing results, and studied medication histories in meticulous detail. What I have discovered is a disturbing pattern that conventional medicine continues to ignore. There exists one specific class of medications that produces serious and often irreversible effects on brain health, yet these drugs are prescribed casually, sold over the counter without restriction, and consumed daily by people who have absolutely no idea they are harming their cognitive function with every dose. The medications I am referring to are called anticholinergics. Now, I know that is a complex medical term, so let me explain exactly what this means and why it matters so profoundly for your brain health. Anticholinergic medications work by blocking a neurotransmitter called acetylcholine. Think of acetylcholine as your brain's memory messenger, the chemical signal that your brain absolutely requires for forming new memories, retrieving existing memories, learning new information, maintaining attention, and processing complex thoughts. Acetylcholine is fundamental to every aspect of cognitive function. When you take an anticholinergic medication, you are deliberately blocking this critical neurotransmitter. And when you take these medications not just occasionally but daily, for months or years or even decades, the harm accumulates silently and relentlessly until one day you suddenly realize your memory is not what it used to be, your thinking feels slower, your mind feels foggy, and you cannot understand why this is happening. Here's what makes this situation so insidious and so dangerous. These anticholinergic medications are not rare, obscure drugs that few people encounter. They are everywhere. They hide in medications you probably consider completely harmless. They are in the Benadryl you take for allergies or to help you sleep. They are in Tylenol PM and Advil PM that millions take nightly. They are in medications prescribed for overactive bladder that older adults take daily for years. They are in certain antidepressants still commonly prescribed. They are in medications for nausea and dizziness that people take regularly. They are in muscle relaxants prescribed for back pain. They are in over-the-counter sleep aids that people consume every single night without a second thought. The pharmaceutical industry has been extraordinarily successful at marketing these medications as safe, effective, and suitable for long-term use. Your doctor prescribes them routinely because that is what they were taught in medical school. The medication helps your immediate symptom, your allergy improves, you sleep better, your bladder control improves, and everyone considers the treatment successful. But what nobody is monitoring, what nobody is tracking, what nobody is warning you about, is the silent accumulation of cognitive harm happening with every single dose. The harm does not announce itself immediately. You do not take an anticholinergic medication and suddenly lose your memory the next day. Instead, the effects accumulate gradually, insidiously, over months and years. Your brain slowly loses its ability to function optimally. The changes are so gradual that you attribute them to normal aging, to stress, to being busy, to getting older. By the time the cognitive decline becomes obvious and undeniable, significant harm has already occurred. And here is the most heartbreaking part: some of this harm may be permanent. Even when you stop taking these medications, some people never fully recover their previous cognitive function because the brain atrophy, the actual physical shrinkage of brain tissue, cannot always be completely reversed. This is not speculation. This is not fearmongering. This is documented scientific reality published in the most prestigious medical journals, conducted by leading research institutions, and observed consistently in clinical practice by neurologists like myself who see these patients every single day. The evidence is overwhelming, the research is conclusive, and yet somehow this information remains buried in medical journals while millions of people continue taking these medications completely unaware of the risks they face. Let me walk you through the specific research that documents these effects, because when you understand the science, you will realize just how serious this situation truly is. The first landmark study that should have changed medical practice immediately was conducted by researchers at the University of Washington. These scientists followed over 3,400 adults over the age of 65 for 7 consecutive years. They meticulously tracked medication use and cognitive function throughout this period. What they discovered should have made headlines everywhere. The individuals taking anticholinergic medications demonstrated a 54% increased risk of developing dementia compared to those not taking these medications. That is not a small effect. That is a massive, clinically significant increase in one of the most feared diseases of aging. But here is what makes this even more concerning: the risk increased with cumulative dose. The longer you take these medications, the higher the dose you consume, the greater the cognitive risk becomes. The second study that profoundly concerns me was conducted at Indiana University School of Medicine. These researchers used advanced brain imaging technology, specifically MRI scans, to examine the brains of people taking anticholinergic medications compared to those not taking these drugs. What they found was visible, measurable, undeniable brain atrophy. The people taking anticholinergics had significantly smaller brain volumes. Their brains had literally shrunk. This was not subjective interpretation. This was objective measurement visible on brain scans. The shrinkage was particularly pronounced in brain regions that control memory formation and learning, the memory centers of the brain and other critical areas for cognitive function. The brain tissue loss correlated directly with cognitive decline measured through neuropsychological testing. But here is the concerning part: when researchers followed up with these patients after they stopped taking the medications, some of the brain shrinkage persisted. The harm was permanent. The brain tissue that had been lost did not fully regenerate even after the harmful medication was discontinued. The third area of research that demonstrates the profound impact of these medications comes from comprehensive neuropsychological testing. When researchers administer detailed memory and cognitive function tests to people taking anticholinergic medications, they find something remarkable and disturbing. These individuals perform on memory assessments as if their brains were 10 to 15 years older than their actual chronological age. Think about what that means in practical terms. A 60-year-old person taking these medications functions cognitively like someone who is 75 years old. A 50-year-old performs like someone who is 65. This is not subtle impairment. This is dramatic, measurable, life-altering cognitive decline that affects every aspect of daily functioning, quality of life, independence, and dignity. But the effects extend far beyond memory impairment alone. Anticholinergic medications also profoundly affect physical function and safety, particularly in older adults. These drugs impair balance and coordination, they slow reaction time, they compromise judgment and decision-making, and they increase confusion and disorientation. The result is a dramatically elevated risk of falls and serious injuries. Emergency departments across the country see countless cases every single day where an elderly patient comes in after a serious fall, and when you review their medication list, you find multiple anticholinergic medications, yet the connection is rarely made by the prescribing physician because they are not trained to look for it, they are not monitoring for it, and the pharmaceutical companies certainly are not highlighting it. This brings me to a story that demonstrates exactly why this matters so much. Let me share a real patient case that changed my entire approach to medication review. Now let me illustrate all of this with a real patient case that demonstrates both the serious effects of anticholinergic medications and the remarkable potential for recovery when these drugs are eliminated and replaced with safer alternatives. Margaret was 68 years old when she first walked into my office 3 months ago. She was accompanied by her daughter because she was too anxious and confused to come alone. Margaret was convinced she had Alzheimer's disease. Her memory had deteriorated so dramatically over the previous 3 years that she barely recognized the person she had become. She would forget her grandchildren's names, people she loved more than anything in the world. She could not remember conversations that had occurred just hours earlier. She would start cooking dinner and forget she had the stove turned on. She had stopped driving because twice she could not remember where she had parked her car or even where she was trying to go. The mental fog was so severe that she had withdrawn from social activities, stopped attending her book club that she had enjoyed for 20 years, and spent most days at home feeling frightened and depressed about her declining cognitive function. Margaret's previous neurologist, a competent and well-meaning physician, had performed standard cognitive testing and ordered a brain MRI. The testing showed memory impairment, and the MRI showed some brain atrophy. Based on these findings, the neurologist diagnosed probable early Alzheimer's disease and recommended that Margaret and her family begin preparing for progressive cognitive decline. He suggested she consider long-term care planning, update her legal documents, and prepare for eventual loss of independence. Margaret left that appointment devastated, believing her life as she knew it was essentially over. When Margaret came to see me, I took a different approach. Before accepting the Alzheimer's diagnosis, I wanted to understand every possible contributing factor to her cognitive decline. I spent considerable time reviewing her complete medical history, but most importantly, I meticulously examined every single medication she was taking, both prescription and over-the-counter. What I discovered was revealing and infuriating. Margaret had been taking Diphenhydramine, the active ingredient in Benadryl, every single night for 5 years. Her primary care doctor had suggested it years ago when she complained of difficulty sleeping, telling her it was safe and suitable for long-term use. Additionally, Margaret was taking Oxybutynin, a powerful anticholinergic medication, for overactive bladder. She had been on this medication for 3 years. Nobody, not her primary care doctor, not her urologist who prescribed the bladder medication, not her previous neurologist, had ever questioned whether these medications might be contributing to her cognitive decline. Nobody had warned her about the potential cognitive effects these drugs can cause. Nobody had offered safer alternatives. When I reviewed Margaret's brain MRI myself, I noticed something her previous neurologist had not emphasized. The pattern of atrophy was entirely consistent with anticholinergic-induced cognitive impairment, not typical Alzheimer's pathology. Her cognitive testing showed severe memory impairment, but other aspects of her cognition were relatively preserved in a pattern more suggestive of medication effect than neurodegenerative disease. Most tellingly, when I ordered specialized testing to look for Alzheimer's biomarkers, they came back negative. Margaret did not have Alzheimer's disease. Her cognitive impairment was entirely medication-induced. I sat down with Margaret and her daughter and explained what I believed was happening. The medications she had been taking for years, medications prescribed by doctors she trusted, medications she believed were helping her, were actually harming her cognitive function. Her cognitive impairment was real, it was visible on scans, it was measurable on testing, but it was not Alzheimer's disease. And most importantly, it was potentially reversible if we acted quickly. We immediately discontinued both anticholinergic medications. For her sleep issues, we transitioned to a comprehensive approach including melatonin at an appropriate dose, magnesium supplementation which supports both sleep and brain health, and detailed sleep hygiene improvements to address the root causes of her insomnia. For her overactive bladder, we switched to mirabegron, a medication that works through a completely different mechanism and has no anticholinergic effects whatsoever. The transformation I witnessed over the following months was remarkable and profoundly gratifying. Within the first 6 weeks, Margaret noticed her mental fog beginning to lift. She described it as if a veil was slowly being removed from her mind. Within 3 months, her memory had improved significantly. She was remembering conversations, recognizing faces more easily, and feeling mentally sharper than she had in years. At 6 months, I repeated her cognitive testing, and the results showed dramatic improvement. She had not returned completely to baseline, some effects had been present that would take longer to heal or might be permanent, but the improvement was undeniable and life-changing. Her 1-year follow-up brain MRI showed no further atrophy. We had stopped the progressive cognitive decline in its tracks. Today, Margaret is back to driving, she has rejoined her book club, she spends time with her grandchildren without fear of forgetting their names, and she has reclaimed her independence and dignity. Her life was not over. Her cognitive decline was not inevitable. She simply needed a doctor who understood the connection between anticholinergic medications and cognitive impairment, who was willing to look beyond the standard diagnosis, and who knew there were safer alternatives available. I share Margaret's story because it is not unique. I have witnessed similar dramatic cognitive recoveries in dozens of patients who eliminated anticholinergic medications and transitioned to brain-safe alternatives. The recovery is not always complete, especially if the medications were used for many years or at high doses, but significant improvement is possible for many people if we intervene before the effects become too extensive. Now let me be very specific about which medications I am warning you about, because knowledge is power, and you need to know exactly what to look for in your medicine cabinet and on your prescription list. Category 1 includes first-generation antihistamines, and these are among the most commonly used anticholinergic medications. Diphenhydramine, which you know as Benadryl, is one of the worst offenders. It is also the active ingredient in many nighttime pain relievers like Tylenol PM and Advil PM, sleep aids like Unisom and Sominex, and countless combination cold and allergy medications. Chlorpheniramine appears in many multi-symptom cold and allergy products. Hydroxyzine, prescribed as Vistaril or Atarax for anxiety and itching, also has strong anticholinergic effects. Millions of people take these medications every single night for sleep or daily for allergies without any awareness of the cumulative cognitive effects they are causing. Category 2 encompasses overactive bladder medications, and these are particularly concerning because they possess some of the strongest anticholinergic effects of any commonly prescribed drugs. Oxybutynin, sold as Ditropan, is one of the most powerful cognitively impairing medications still widely prescribed. Tolterodine, marketed as Detrol, and Solifenacin, marketed as Vesicare, are equally problematic. These medications are prescribed casually to millions of older adults, the very population most vulnerable to cognitive decline, yet doctors rarely warn about the cognitive risks or offer safer alternatives. Category 3 includes tricyclic antidepressants, older medications that are still frequently prescribed despite their significant anticholinergic effects. Amitriptyline, commonly known as Elavil, and Nortriptyline, known as Pamelor, are still used for depression, chronic pain conditions, migraines, and insomnia. While they can be effective for these conditions, the brain health cost is often not worth the benefit, especially when safer alternatives exist. Category 4 consists of anti-nausea and anti-vertigo medications. Meclizine, sold as Antivert or Bonini, is widely used for dizziness and motion sickness. Promethazine, known as Phenergan, is commonly prescribed for nausea. Both have significant anticholinergic properties that affect brain function, particularly with regular use. Category 5 includes muscle relaxants, particularly cyclobenzaprine, marketed as Flexeril. This medication is frequently prescribed for back pain and muscle spasms, often for extended periods, and it possesses strong anticholinergic properties that many prescribing doctors never mention to their patients. Now you might be wondering, why do doctors continue prescribing these medications despite overwhelming evidence of their cognitive risks? The answer is complex and frustrating. First, medical education lags decades behind current research. Many physicians, even those who graduated relatively recently, were trained before the full extent of anticholinergic cognitive effects were understood, and they never updated their knowledge because they are overwhelmed with information and focused on immediate patient concerns. Second, pharmaceutical industry influence has systematically minimized acknowledged risks for decades. The companies profiting from these medications have no incentive to highlight cognitive risks, and they fund much of the continuing medical education that doctors receive. Third, doctors focus primarily on treating immediate symptoms. If your allergy improves, if you sleep better, if your bladder control improves, they consider the treatment successful regardless of long-term cognitive consequences they are not monitoring. Fourth, patients rarely connect memory problems that develop gradually over years to medications they started taking long ago, so doctors never see the pattern linking prescription to cognitive decline. But here is the empowering part of this message, the reason I wanted you to stay until this point in the video. Safer alternatives exist for virtually every single condition these anticholinergic medications treat. You do not have to choose between symptom relief and brain health. You can have both if you know what to ask for and you are willing to work with a doctor who understands these alternatives. For allergies, the solution is remarkably straightforward. Second-generation antihistamines including cetirizine, which you know as Zyrtec, and loratadine, which you know as Claritin, are highly effective for allergic symptoms but have minimal ability to cross the blood-brain barrier, meaning they do not significantly affect brain function or cause the cognitive impairment associated with first-generation antihistamines. They work just as well or better for allergies without harming your cognitive function. Even better than simply switching antihistamines is addressing the root causes of your allergies through dietary modifications that reduce inflammation, environmental controls that minimize allergen exposure, and natural approaches including quercetin and other supplements that support healthy immune function without any cognitive effects. For sleep difficulties, the alternatives are even more effective long-term than anticholinergic medications. Melatonin, when used at appropriate doses and timing, helps regulate your natural sleep-wake cycle without any cognitive side effects. Magnesium supplementation, particularly magnesium glycinate taken in the evening, supports relaxation and sleep quality while also benefiting brain health rather than harming it. Most importantly, comprehensive sleep hygiene improvements address the underlying causes of insomnia rather than just masking symptoms with medication. This includes maintaining consistent sleep and wake times, creating an optimal sleep environment that is dark, cool, and quiet, limiting screen time before bed, managing stress through relaxation techniques, and addressing any underlying sleep disorders like sleep apnea that might be contributing to poor sleep quality. For persistent insomnia, cognitive behavioral therapy specifically designed for insomnia is more effective long-term than any medication and produces lasting improvements without any side effects or cognitive concerns. For overactive bladder, behavioral modification should always be the first approach. This includes bladder training techniques that gradually increase the time between bathroom visits, pelvic floor exercises that strengthen the muscles controlling urination, dietary modifications that avoid bladder irritants like caffeine and artificial sweeteners, and fluid management that maintains adequate hydration while avoiding excessive intake before bed. For many people, these approaches alone produce significant improvement. When medication is truly necessary, mirabegron, marketed as Myrbetriq, works through a completely different mechanism than anticholinergic medications. It relaxes the bladder muscle through beta-3 receptor activation, so it improves bladder control without any of the cognitive side effects associated with traditional bladder medications. For depression and mood disorders, modern antidepressants including selective serotonin reuptake inhibitors like sertraline, fluoxetine, and escitalopram, or serotonin norepinephrine reuptake inhibitors like venlafaxine and duloxetine, are highly effective without anticholinergic effects. These medications work through different mechanisms that do not impair cognitive function. Combined with evidence-based psychotherapy, regular exercise which has profound effects on mood and brain health, and nutritional approaches that support neurotransmitter production, most people can achieve excellent depression management without exposing themselves to cognitively impairing anticholinergic medications. For nausea, ondansetron, which you might know as Zofran, is highly effective without anticholinergic properties. It works by blocking serotonin receptors that trigger nausea and vomiting, providing excellent relief without affecting brain function or memory. For vertigo and dizziness, vestibular rehabilitation therapy, a specialized form of physical therapy, addresses the underlying balance system dysfunction and produces lasting improvement without any medication side effects. For muscle spasms and pain, the reality is that muscle relaxants including anticholinergic ones are rarely more effective than safer alternatives. Physical therapy, targeted stretching exercises, heat and cold therapy, and when medication is truly needed, short-term use of anti-inflammatory medications or targeted treatments for the underlying cause of the muscle spasm. All of these approaches work as well or better than muscle relaxants without the cognitive impairment. So what exactly should you do right now with this information? Let me give you a clear, step-by-step action plan that you can implement immediately to protect your brain health. Step 1. Review every single medication you are currently taking, both prescription and over-the-counter. Go through your medicine cabinet right now, today, and write down the name of every medication you take regularly or even occasionally. Do not forget things you take for sleep, allergies, nausea, or pain. Many people do not even mention over-the-counter medications to their doctors because they do not consider them real medications, but these are often the worst offenders when it comes to anticholinergic cognitive effects. Step 2. Check each medication against the list I provided in this video to determine if any are anticholinergics. If you are watching this video, you can pause and review the list, or you can search online for anticholinergic medication lists. There are comprehensive databases available that rate the anticholinergic burden of different medications. Step 3. Document all cognitive symptoms you have been experiencing, and be specific and detailed. Write down when you first noticed memory problems, how they have progressed, specific examples of forgetfulness or confusion, any mental fog or difficulty concentrating, any word-finding difficulties, any changes in your ability to learn new information or complete complex tasks. Include the timeline of when these symptoms started relative to when you began taking any anticholinergic medications. This documentation is crucial because many doctors will not make the connection unless you present it to them clearly and explicitly. Step 4. Schedule an appointment with your doctor specifically to discuss your medications and safer alternatives. Do not try to address this during a brief routine visit where the doctor is rushed and focused on other issues. Request a dedicated medication review appointment where you have adequate time to discuss your concerns thoroughly. Bring your symptom documentation and your medication list. Step 5, and this is critical, do not stop taking any prescription medications abruptly on your own without medical supervision. Some medications, particularly certain antidepressants and bladder medications, require gradual tapering to avoid withdrawal symptoms or rebound effects. You need medical guidance for the transition. However, you absolutely have the right to insist on an honest evaluation of whether the benefits of each anticholinergic medication you are taking truly outweigh the documented cognitive risks, especially when safer alternatives exist. Step 6. If your current doctor dismisses your concerns, minimizes the risks, refuses to consider alternatives, or tells you that the cognitive evidence is not significant, do not accept that response. Your cognitive function matters. Your brain health matters. Seek a second opinion from a neurologist or a geriatrician who specializes in medication management for older adults. There are doctors who understand these risks and who are willing to work with you to find safer alternatives. Step 7. Once you have successfully transitioned away from anticholinergic medications, commit to ongoing brain health optimization. This includes regular physical exercise, which is one of the most powerful interventions for brain health and cognitive function, a nutrient-dense diet rich in omega-3 fatty acids, antioxidants, and B vitamins that support brain health, stress management through meditation, mindfulness, or other relaxation techniques, quality sleep which allows your brain to clear toxins and consolidate memories, ongoing cognitive engagement through learning new skills, social interaction, and mentally stimulating activities, and regular monitoring of your cognitive function so you can catch any decline early and address it promptly. Now, if you need to leave right now and cannot watch the rest, let me give you the 60-second summary of everything we have covered. Anticholinergic medications, drugs like Benadryl, Tylenol PM, and bladder control medications, can seriously harm your brain and memory over time. Research shows they increase dementia risk by 54% and cause visible brain shrinkage. Check every medication you take against the anticholinergic list I provided. Schedule an appointment with your doctor to discuss brain-safe alternatives that work just as well without the cognitive risks. Never stop medications abruptly without medical supervision. Recovery is possible when you transition to safer options. The complete medication list, action steps, and all references are in the video description below. Now, if you have a few more minutes, stay with me because I want to leave you with an empowering final message about protecting your brain health. As we close this discussion, I want to leave you with a message of hope and empowerment rather than fear. Yes, the information I have shared today about anticholinergic medications is serious and concerning. Yes, millions of people are unknowingly harming their brains with medications they believed were safe. Yes, the medical system has failed to adequately warn patients about these risks. But here is the empowering truth: now that you possess this knowledge, you have the power to protect yourself. You have the power to make informed decisions about your medications. You have the power to advocate for safer alternatives. You have the power to preserve your cognitive function for decades to come. Your brain possesses remarkable capacity for recovery and healing when you remove what is harming it and provide what it needs to thrive. I have witnessed this transformation repeatedly in clinical practice with patients like Margaret, whose story I shared earlier. The cognitive improvement can be dramatic and life-changing when anticholinergic medications are eliminated and replaced with brain-safe alternatives. The sooner you act, the better your potential for cognitive restoration, because while some effects may be long-lasting if medications are used for many years, earlier intervention allows for more complete recovery. This is not about living in fear of every medication. This is about informed choice. This is about understanding that when your doctor hands you a prescription, you have the right and the responsibility to ask questions. What are the long-term risks of this medication? Are there safer alternatives available? How will this affect my brain health over time? These are not just reasonable questions, they are essential questions that every patient should be asking but most never do. The pharmaceutical industry profits when you take medications long-term without questioning their safety. Your doctor means well but may not have updated knowledge about anticholinergic cognitive risks. The system is not designed to protect you from these risks. You must protect yourself through knowledge and informed decision-making. Share this video with everyone you know who takes any of the medications I discussed today. Share it with your parents, your grandparents, your friends, anyone who might be unknowingly harming their brain with anticholinergic medications. This information could literally save someone's cognitive function and prevent devastating dementia that would otherwise have been avoidable. Subscribe to this channel and hit the notification bell so you never miss critical information that could protect your health. Comment below and let me know, are you currently taking any anticholinergic medications? Have you noticed cognitive changes since starting them? Your story could help others recognize the pattern and take action to protect their brains. In my next video, I will discuss the specific nutrients, supplements, and lifestyle strategies that accelerate cognitive recovery and build lasting brain resilience after anticholinergic medication exposure. You will not want to miss that critical information. Remember, knowledge is protection, information is power, and you now possess information that can preserve your brain health, your memory, your cognitive function, and your independence for many years to come. You deserve to age with your mind intact, your memories preserved, and your cognitive abilities thriving. Do not accept cognitive decline as the necessary price of treating treatable symptoms when safer alternatives exist. I am Dr. Awa Mitchell, and I will see you in the next video where we continue this crucial conversation about protecting and optimizing your brain health.